You looked at the diagnostic manual 10 years ago, you would have seen OCD listed as an anxiety disorder. But you might be surprised now to see that it's listed as an OCD and related disorder in an entirely separate category. What we're going to do today is talk specifically about how those disorders might be linked to each other and how OCD, being the kind of opportunistic disorder that it is, might want to glom onto some of them and say, ooh, we can use some panic as a way to scare people into doing compulsions, or hey, you've had a trauma, I've got a solution for you to make sure it never happens again. OCD. I'm Dr. Patrick McGrath. I'm Chief Clinical Officer at NOCD and a licensed psychologist who specializes in the treatment of OCD and anxiety-based disorders. Let's start with a review of these disorders, and we'll start with panic. We don't diagnose people with panic. You diagnose people with panic disorder, but just because you have a panic attack doesn't mean that you have a diagnosable condition. The likelihood is almost every human is going to have a panic attack at some point in their lives. And that will be a rush of symptoms, 4 or more occurring within about 10 minutes or so. And those could be things like feeling numbness or tingling sensations, chills or hot flashes, tightness in your chest, difficulty breathing, a rapid heartbeat, feeling kind of depersonalized, a feeling as if you're going to faint. Those are just some of the different things that can happen during a panic attack. Then there's generalized anxiety disorder, which is a worry-based disorder, and it's at least 6 months or more worrying about things. And along with that comes several different kinds of experiences. You have to have at least 3 of them, and that could be things like difficulty focusing or concentrating, feeling restless or keyed up on edge, irritability, muscle tension, sleep disturbances, things of that nature. Let's talk about worries for a moment. Worries are very important to discuss, and they might even seem like obsessions to people. But here's what happens. Worries make more worries. That's what they do. In generalized anxiety disorder, or GAD, we don't see compulsions happening. We see more worries. The other things that are listed as anxiety disorders are ones you might be familiar with as well. There's phobias. There's like fears of elevators or escalators. There's fears of, well, just about anything that you can think of, someone would probably have a phobia. All of these have, again, an underlying anxiety experience. You can differentiate some of those, though, between what we talked about and obsessive-compulsive disorder. Let's talk about the cycle of obsessive-compulsive disorder and what it looks like. People experience obsessions based on some kind of trigger that occurs in their life. Those obsessions are intrusive thoughts or images or urges, and we want to neutralize them as quickly as possible. So we do this compulsion. It is a mental or behavioral act to get relief from the obsession that we're experiencing. Unfortunately, it only works for a little bit, and then we have to do it over and over and over. What about the other anxiety disorders? What's happening in those situations? Very often there's avoidance in those other disorders. That's kind of the main way that we'll see people dealing with safety. So if somebody's had a panic attack somewhere, they're going to avoid that place to not have any more panics. If somebody's been through a traumatic event in a place, they want to avoid that to have no reminders of the traumatic event. The typical way we deal with a phobia is we avoid something. So if we're afraid of elevators, we take the stairs. We avoid elevators at all costs. Lots of avoidance going on in those situations. In OCD, there's obsessions, and those do bring about distress or anxiety, but they can also bring about shame and guilt and other types of feelings that are uncomfortable. And the one thing that happens in OCD that doesn't happen in the other disorders is compulsions. That's one of the differentiations that we really want to talk about here. How do these interact with each other? Well, OCD can be very opportunistic. So OCD might send a message to you that says, hey, if you don't do the compulsion, you're going to have a panic attack, and you know how uncomfortable panic attacks are. Or, wow, you've been through a traumatic event, but you know what? I've got the solution for you. I'll make sure it never happens again. I'm going to keep it at top of mind for you at all times, and I'm going to have you do compulsions all day long. And those compulsions, they're actually going to prevent the bad thing from ever happening again. OCD does not want to go away. It wants to stick around for a while. So it likes to be fed compulsions, and since you're feeding it, it's not going anywhere. If this sounds like something that's going on with you, there is treatment available. That treatment is called exposure and response prevention therapy, or ERP. Luckily, for even the anxiety disorders we talked about today, there's various forms of ERP that you would use even for those disorders as well. In OCD, we would purposely expose you to the obsessions that you're experiencing. those uncomfortable thoughts or images or urges. The key component, though, is we're going to have you do response prevention, which is the elimination of the compulsion. Now, I don't do this to torture you. I recognize that this will be uncomfortable, though, so know this. When you do this and you learn, hey, I didn't do the compulsion and the obsession didn't happen, nothing bad occurred, wow, great. And when you do it again and again and again and start to realize, I actually don't need to follow what the OCD rules are. I don't have to do the compulsions. That's how we would work it with OCD. In panic, I would have you do interoceptive exposures. I'd have you do bodily sensation things that are uncomfortable, like spinning in a chair or running in place or hyperventilating or even breathing through a straw, and teaching you, you don't have to be afraid of bodily sensations. That's really what panic is. It's a fear of all of the different kind of symptoms that you might experience. For people who've experienced a trauma, we do prolonged exposure. I might have somebody write out the story of their traumatic experience and read it to me over and over and over again. And as odd as this sounds, the more they do that, the less emotional connection they will actually have to that story. But you know what unfortunately keeps people stuck in trauma? Telling someone not to think about it anymore. With worries, well, we know that people are going to worry, so sometimes we even have people do the opposite of the worry, and they wish for the thing they're worrying in order to recognize that whether they worry about it or wish for it, it doesn't seem to influence the occurrence of it whatsoever. If any of this sounds like something that could be helpful to you, from OCD all the way through these other anxiety-based disorders, know that help is available. If you are going to seek out a therapist, interview them and find out, do they really know what OCD and ERP is, and do they utilize it to treat anxiety and OCD? And have they treated other cases of those things before? And if not, are they at least under the supervision or consultation of an expert in the field? The International OCD Foundation has great links for therapists who treat OCD, and so does NOCD as well. You can download the NOCD app for free, or you can go to NOCD.com. They will set you up with a free 15-minute call. After that call, you can start doing OCD therapist who will walk you through ERP for the conditions that you have. Between your sessions, you can use special therapy tools, you can also message your therapist, and you can even attend peer-led support groups. If what I've talked about today sounds like something that's going on for you, please reach out to the links below and also check out other information on Healthline. We want to make sure that anxiety and OCD aren't controlling your lives. Please reach out for help. It is available.